I'm Kaylee Gerace. I'm an allergist with Advanced ENT Allergy, and this is just going to be a quick video about how to use an inhaler and a spacer. So a lot of times I have patients who come in and they ask like, oh, I'm an adult, do I really need to use a spacer? And I always encourage my patients to use it. I think it makes the inhaler easier to take and also can help with the deposition of the medicine. So anytime you get a new inhaler, you wanna make sure you shake it. You're gonna have to prime it when you first get it from the pharmacy. So you wanna do a few puffs into the air, make sure the medicine is loaded and that it's ready. With the spacer, there's lots of different kinds, but they all look pretty similar. You put the inhaler in the end. You want to make sure that you get it in there tightly. Every time you take the medication, you do need to shake it up for a few seconds. That just allows the medicine to mix so that way you're getting a full dose. The next step would be you're going to inhale the medicine. So you want to exhale fully. You're going to put the spacer in your mouth. Start to inhale and poof. And then you're gonna breathe in really slowly. Hold your breath for about 10 seconds if you can, and then you'll let it all out. So now I'll just show you. Ten seconds never felt so long. And then you want to rinse your mouth out or brush your teeth, just so that way you don't get anything like thrush.